Now I'll demonstrate the final step of our discharge process where we communicate with the primary care provider. If we're discharging our patient to a physician within our system, we will use an inbox message. If the physician is outside our system, we will fax the discharge summary. So for a patient inside our system, I'm in the inbox now, and I'll click on New Message, and unfortunately in this version of Cerner, I have to select the patient again. It doesn't know whose chart I have opened. I select here the PCP, and then I change this subject of the message to inpatient discharge notification. We have a template here which currently we don't like, so I delete that, and unfortunately I have to go over to a Word document that we all have. This is our most up-to-date version of our discharge summary notification, and I'll Control C to copy that back to the inbox message, Control V to paste it into the message, and basically the components it has is I'll say the patient is discharged to home. Pretty kludgy. And then this is a reminder that I fill out this next section, so I can delete that reminder to me and put in today's date, the diagnosis, my greatest concerns for the patient over the next 5 days, the outpatient's actions that can be taken to prevent a readmission, the patient's greatest concerns, what follow-up appointments I'd like the patient to have, and then my assessment of the risk for readmission, which labs are pending at admission, which labs the patient needs at follow-up. This message, when it's routed to the primary care provider, also goes to someone called their flow manager, and there's instructions here for the flow manager, which include making sure that the follow-up patients are scheduled, making sure that the lab will know about the labs that the patient needs when the patient arrives at the lab, calling the patient to confirm the appointments, and then forwarding this message on to a patient's care manager. Here's instructions for the care manager to review the notes above about concerns, and this is a reminder to contact the patient if they didn't show up for their patient. And then this message gets saved back to the patient's chart.